So thank you so much and good afternoon, everyone, for the opportunity to come along and tell you about our QI project, Shake It Till You Make It. It's the introduction of a fortified milk drinks round, or milkshake round, sorry, in one of our care homes. So can I firstly just introduce our team, my team. As you can see on our slide, hopefully there, it was made up of different professionals across different disciplines within our trust. We had two nurses, two dietitians, and then our business support worker, Curtis there, who was great for helping us with our data. So just to give you a wee bit of background, as I don't need to tell anyone here, I mean, good nutrition and hydration is essential for every stage of life. And as we age, our nutritional needs for the older population, they require a more nutrient-rich diet just to maintain that good health and well-being. But unfortunately, undernutrition or malnutrition is so common in our older adults for reasons including dysphagia and chronic illnesses like dementia, etc. And that sort of undernutrition causes the physical and functional decline, like sarcopenia and increased risk of falls and fractures. And the results then is just poor health outcomes for residents in care homes, and that increases their care needs, not just from the staff within the care home, but also from care services within the trust. So treatment, therefore, and prevention of undernutrition is essential. And I know I'm not telling anyone here anything they don't already know. However, it is so important just to really highlight it. But oral nutritional supplements are frequently prescribed to treat undernutrition, and there are so many available now on the market. However, they still don't offer any more nutritional value than the nutrient-rich food and fluids that we can provide in food and drinks, and are not intended for long-term use. Despite that, in the Belfast Trust, 34% of care home residents are on prescribed ONS. Now, that is the number of residents who are on prescribable supplements. It doesn't actually give us the number of of supplements. So there are some residents who could be on 2, 3, or 4 supplements per day. And here in Northern Ireland, we actually have the highest ONS spend in the whole of the UK. So despite being one of the smallest of the 4 countries, we actually are the biggest spenders. So in our team, we decided that we wanted to try and do a QI project to try and halve the number of ONS prescribed for residents within one of our care homes, City View Cork, by June of 2025. So to achieve our aim, we focused on 3 sort of primary drivers. That was improving the quality of life for our residents by enhancing the enjoyment and palatability of the fortified drinks that they were being offered, and by increasing the variety of milkshakes that were being offered. We wanted to enhance nutritional intake and status by matching the nutritional content of current ONS, supporting residents to maintain or ideally increase their weight, and then just improve that compliance of milkshakes taken, and increase staff and family knowledge and their involvement as well in the residents' nutrition. And finally, we wanted to sort of reduce the associated costs and environmental impact by lowering healthcare costs and cutting the CO2 emissions linked to pharmaceutical productions. And over the next few slides, hopefully I'll show you how the change ideas there that is on the screen, how we put that into place. So one of the first things that we did was we created a process map with some of the care home staff, including the home manager that you can see on the picture there, the care assistants, and our chef. This allowed us to understand the current process of when an ONS is prescribed, and sort of visualize how things might change if we did introduce that homemade fortified milkshake round. We had a fair idea. We thought we knew what the process was, but we just wanted to check with the staff there to make sure that we really fully understood before we went in and started making changes. So the next thing, we worked a lot with the chef to develop the milkshake recipe. And we quickly realized that the number of glasses that home had was extraordinary. They had every shape and size that you can imagine. And we wanted to make sure that it was consistent, that each resident was getting a prescribed amount each day. And the answer actually was given by the chef, because he typically kept the glass you can see there on the right-hand picture in the kitchens for serving puddings to those residents who are on modified diets. And the line on that glass was 160 mils. And while a lot of our ONSs prescribed were between 125 mils and 200 mils, we felt that that sort of, if we could develop a milkshake recipe based on 160 mils, then we would be sort of matching like for like in terms of volume. But trying to keep to the 160 mils meant it took a few attempts to match the nutritional content of the commonly used ONS. We were very limited to what the homes can get in terms of from their food wholesalers. They can buy from external sources, but it's not sort of the norm. They do try and stick to what they have on their list. And we couldn't match it exactly. You can see there I've compared it to two of the compacts that are on sale at the minute. And the thing that we found hardest was the protein content, just because of the milk powder that we had to use that was available to us through the food supplier. But we got as close as we possibly could, and we took that into consideration when we were doing our dietetic assessments. And during the development of the recipe, we also conducted some blind taste testing sessions to gather feedback from the staff, the residents, and some family members on both the fortified milkshakes, which were on the right there, and that's number B, or letter B, sorry, and in the ONS. These sessions confirmed that the milkshakes were preferred over the ONS. And by continuing the project, we weren't just trying to do something that we wanted to do. We were actually enhancing that palatability and enjoyment, and hopefully the compliance then of the Bill of Right drinks. So baseline dietetic assessments were completed on 9 residents to begin with. There had been 11, but unfortunately 2 passed away during the project, and so their data was removed from the project. We did exclude those who were on thickened liquids, just to make the process of initially introducing the milkshake round easier for the staff, without the added need to thicken the milkshake to the correct level as well. And then staff were trained on various dates, and we encouraged all the care staff, domestics, kitchen staff, anybody who wanted to come, we welcomed them, mainly to explain what the project was about, why we were doing it, and although it would be extra work for them, the importance of their role in a resident's nutrition. So our outcome measures then, well, we wanted to decrease the number of ONS used and increase the use of the fortified milkshakes. And some of the processes measures that we used were, we were monitoring the milkshake compliance by evaluating fluid balance charts completed by the care staff. What my colleague Vasa, she did monthly dietetic assessments instead of quarterly. And we looked at the monthly weights, food charts, and just the residents' nutritional intake. And then we adjusted the dietetic care plan accordingly. One thing we wanted to do was, rather than take them all off every supplement they're on, if somebody was on multiple supplements, we did try to take one supplement off at a time to make sure that it was tolerated, and then as each assessment went on, then we increased the number of milkshakes and decreased the number of supplements. We used feedback from the staff, residents, and relatives, verbally and via questionnaires consistently throughout the process, just to make sure that we were still on the right track. As I say, the training sessions were delivered as and when needed. So some of our balancing measures then just include, obviously, it was more work for the chefs and the care staff. So getting them on board right from the onset was really important, because we knew that without their help, without their work, this wouldn't be a success. And thankfully, they all did very much get on board, which was great for us, because the ingredients available and the cost of the milkshakes was obviously a big factor for the home, because supplements, they come free to a care home in Northern Ireland, whereas they obviously have to then take the milkshake out of their budget, and it was coming in at around 58 pence per day, which, when you consider that the budget could be anything from £4 to £5 per resident per day, it's quite a lot. But thankfully, as I say, the home really did get on board and wanted to do this for their residents. And obviously, it was a wee bit more work for Rasa to begin with, but she was very much on board as well. So this is just our run chart then, and it shows the number of supplements that were prescribed for the residents in City View Court. And as it changed, we introduced sort of small structured improvements using our PDSA cycles that I've mentioned there on the right-hand side. So we started off with 16 supplements prescribed to 9 residents. And then we introduced things like sign sheets for the nurses to monitor and record if their milkshakes were being given and taken. We used weekly meetings with the care home manager, and this just sort of helped those sustained changes and try and maintain that ONS prescription continue to drop. And by the end of the project, we were down to 5. And the reason there were still sort of 5 there was because some of those residents couldn't drink anymore, but were maybe on a pudding style supplement. So we feel that there is definitely work there that we can do to reduce that further. So some of the learning from our project was we really did see a shift in the mindset of the care home staff on supplement reliance, and that they could see the benefit of a homemade fortified milkshake, and that it can be easily provided by their chef and given by their care staff, which provides a similar sort of nutrition but tastes a lot better. And we also learned how to effectively communicate with an organisation outside our trust, who have different staff, different budgets, and just different agenda altogether. In saying that, we really did enjoy working well with the staff of City View Court. We got to know them really well, and by the end, I think the chef was sick of seeing me, but at the same time, whatever I asked, he really did get on board with, so he was great. We developed as a team new QI skills and the process in carrying out that QI project, which we will then use in future QI projects. But most importantly, it was improving the quality of life for the residents within that home. And here's a couple of quotes that we got from the residents and the care staff. So they really did. I mean, I fully believe that's how the resident looked when she told Rasa that she loved the drink, but obviously no project is without its challenges. And some of the things we faced was just understanding that different organizational system. And we did have some supply issues with the milkshake ingredients from the wholesaler, which was not always communicated to us at the time. And so sometimes they didn't give the milkshakes at the amount that they were meant to. Some residents did have episodes of loose bowel motions, but we never really got to the bottom of whether it was linked to the milkshake or not, because within a couple of days it was always settled. And I said, by the time that the staff would have told us, they would have been better again. So we weren't sure if we needed maybe like a lacto-free milkshake, or it was just something that was going to be going around the home at that time. And then one of the biggest problems was there was illness in the home at that time. It was around sort of Christmas time, and there was reduced oral intake just because people were unwell. So it was difficult to achieve nutritional requirements. But I mean, that's a common problem we have in healthcare, and it's not just for this project. So, but some of the benefits was that we did achieve our aim. So we weren't looking for half. We actually got 69% of our ONS prescription were reduced, which was excellent. We maintained the nutritional status of the majority of the residents. As you know, sort of weight normally fluctuates up to 5%. So we were able to keep the majority of our residents between that 5%. There was one, unfortunately, who lost over 10%, but he has palliative throat cancer, which affected his swallow. So actually getting his oral intake to meet his nutritional requirements was very, very difficult because he just struggled to eat and drink. But he was one of our big advocates for the milkshakes. He really did enjoy it. So we kept them on them, even though he was palliative. Another benefit then was the increased knowledge for the staff and the skill sets that they've now got. So when speaking to the home manager recently, she noticed that the milkshakes were really well tolerated. It was an integral part of their day. And they were actually now, because it's not a prescribable product, we're offering it to other residents who they felt weren't eating as well and maybe were at risk of needing to go on a supplement in the future, but actually they had put this in place instead. So that's great to see. And then from December of 24 to June of 25, we reduced the number of prescription costs by about £930, and that was just from 9 residents. So if you extrapolate that up to our 45 homes in the Belfast Trust, we do feel that there is going to be a significant cost saving. And then the associated CO2 emissions then was about 145 kilograms. So every little bit of help to the environment also is encouraging. So the next steps then, we are hoping to continue to monitor our residents as part of our dietetics care pathway. I'm glad to say that the milkshakes are still ongoing. They are being offered to, as I said, the other residents who are losing weight. So on the long term, we would like to see that the number of prescription of supplements continues to stay low in that home. And then the next thing we want to do is obviously expand the selection of fortified milkshakes or drinks available to include maybe like smoothies and things that are lactose-free, and then something that our residents with dysphagia can also take. And then, as always, we want to scale and spread to other care homes within the Belfast Trust. And we have already got a couple of homes that we've presented this presentation to who have come and contacted us saying we want to get involved as well, because we do believe here that transformation, it begins with when one wee small ripple of change is carried forward, and we want to achieve that going into our other homes. So thank you very much. Sorry that I was delayed in getting to you. I'm sorry.
That's fine. Don't worry. I think this is a great project, Sarah, because it's I think that change in mindset is really important. And also I think getting care homes on board to pay a little bit extra when budgets are so tight all the way around, aren't they?
Yeah, and unfortunately the first home now we went to, they turned us down and said they couldn't facilitate it. However, in saying that, we've now managed to get in with the owners of that home group, and they have got on board with us, and we are starting in the start of 2026. Joy and I will be going in to have discussions with how can this be rolled out across 10, I think with 10 homes in Belfast Trust, but it's across Northern Ireland. So as I said, the ripples are we're starting to catch up with the mainland, I feel.
Well done, you two. These are two very, very interesting projects. I think people will find them interesting. And I'm sure they could just email you if people want to ask some questions.
Absolutely.
And I hope your little lad's okay.
Bless him. He's just sitting here.
Oh. So much juggling to do, isn't there? Families, work, all sorts of things. Well, thank you very much.
Thank you so much.